And talking health now, health stakeholders in Nigeria have called on governments to do more in supporting persons living with tuberculosis. They made this appeal in the nation's capital, Abuja, as they met to review the progress made in the management of tuberculosis in the last few years in preparation for the upcoming United Nations high-level meeting on tuberculosis management and prevention. Marvelous Obomanu completes the reports.
United Nations meeting where stakeholders and leaders met to adopt a roadmap to ending tuberculosis in 2030 was 5 years ago in 2018. Another consultative meeting is coming up towards the end of September, and stakeholders here in Nigeria have met to discuss the journey so far and what to present at the upcoming meeting. Nigeria, many of them say, has made some achievements, but more needs to be done in the areas of funding, detection, awareness, amongst others.
Nigeria is occupying an unenviable position of being the country, the #1 country with the highest burden of tuberculosis in Africa and 6th in the world. Maybe to better understand it better is that about 15 people in Nigeria die every 1 hour of tuberculosis.
We've made significant progress in the area of TB case finding. We've made progress in the area of innovation. We've also made progress in the area of improving preventive treatment for TB, as well as in the area of leadership and governance.
Although the stakeholders say Nigeria is greatly burdened with tuberculosis, they believe that adequate funding will help reduce the spread of the disease.
If you don't have the funding, you may not be able to move, an inch. You need the money to be able to engage people. You need the money in order to acquire the latest tools.
We also need to prevent ourselves. Look at when COVID came and we're all using nose masks and the rest. We need to do everything possible in terms of housing, in terms of our living conditions to prevent ourselves from contracting tuberculosis. Then we also need to support people who might have this disease. We need to be able to provide them with nutritional support, with psychosocial support that they need.
They further resolve to create more awareness on tuberculosis.
Not only just sitting down in the facilities to wait for the people to come, but we need to also generate the demand for it. We need to engage some certain populations, like the civil society, to also generate the demand, because it may have the best facility, but people will not access it because the demand is not there.
It's quite unfortunate that even in 2023, many people in Nigeria either are not aware of tuberculosis, or they are aware they are having a misconceptions, or they think, in fact, some elites tells us they think tuberculosis has been eradicated. Sorry, the answer is no. Tuberculosis is still here and it's everywhere. Like we say, TB anywhere is TB everywhere.
Many of them say Nigeria's government will need to show political will to implement the agreements that will be reached in the high-level meeting. Marvelous Obomanu reporting for News Central.
To discuss this, I'm being joined by Dr. Gidado. Mustapha is the Executive Director, Global KNCV Tuberculosis Foundation, Netherlands. Thank you so much, Doctor, for talking to us.
Thank you for having me.
Now, Nigeria, according to statistics, is highly burdened with tuberculosis. How did we get to this point, and what can we do to reduce the numbers?
Well, the current performance and the burden of tuberculosis in Nigeria is the reflection of the global performance of TB in general. In the last 3 years, globally, TB has actually been drawn back in its own performance, not a big thanks to the COVID-19 pandemic and all the global crises. But more specific to Nigeria, I think the overall burden of tuberculosis in Nigeria, which at the moment is 219% in every 100,000 population, meaning that we are actually having not less than 500,000 persons affected with tuberculosis in Nigeria on an annual basis. This is not unrelated to the just general population size of Nigeria, but also two to three, four major drivers of this epidemic. One of them is definitely poverty. Of course, HIV epidemic is also a major driver. Of course, malnutrition, undernutrition is a significant driver of tuberculosis in Nigeria, and some form of comorbidity, especially diabetes mellitus. And if you have seen what has happened to Nigeria in the last 10 years with all the insurgency, with the security challenges, that has a direct impact on healthcare facility utilization and displacement of human beings. So our current placement of TB is from both the drivers and also barriers to the performance. And the barriers to the performance of TB program at the moment are not really unrelated to the overall insecurity, underperformance of the healthcare facilities in general. There is also weakness in collaboration between the public and the private sector in general, and sometimes also weakness in collaboration between different agencies that are actually fighting bigger diseases in Nigeria, like tuberculosis, the HIV, and malaria. So there's quite a lot of need for synergy and need for coordination so that we can leverage significant amount of resources in Nigeria. You have asked what can we do to get out of this, and clearly two things need to happen right now if we need to get out of this, is by really scaling up diagnosis access. Everyone with the disease must be given access to diagnosis in Nigeria. And second one is that everyone that is screened for tuberculosis must be provided TB preventive treatment at this moment. While by 2025, some tools need to be available if we must end TB by 2030. We must globally and also in Nigeria have access to point of care tests, but there must also be access to vaccine if we must end TB by 2030.
All right, Doctor, you have talked about the scaling of diagnosis, and there are other talks as regards creating awareness, case finding, procurement of advanced medical equipment, and supporting those living with tuberculosis. And those were part of the statements made during the stakeholders meeting held in Abuja recently. Are these also critical to dealing with the issue of tuberculosis in our community and, of course, in our society?
I think those discussions were absolutely correct. They were totally on point. Managing tuberculosis is completely from 2 to 3 fronts. It is a public health response, but it is also a medical response. But it is extremely important for us to realize that in places like our own country, Nigeria, access to healthcare facility need to be supported by a comprehensive community system and community-driven structures that will enable people to be aware and to be willing and to be able to access those healthcare facilities. But while we are creating the demand for the services, we must also make sure that the services are of high quality, the people trust the services, and that is where the issues of expanding our services beyond the existing public health system to also ensure that the private sector are fully engaged into the fight against tuberculosis in Nigeria. So they are really, really on point, and all this can only be done through effective coordinative mechanisms at the different tiers of government, but also by really significant engagement of the private sector.
We are also aware, Dr. Gidado, that in 2018, Nigeria participated in a meeting that had also the United States and other stakeholders at the meeting to discuss issues around tuberculosis. And there was a political statement and a roadmap to actually help in dealing with tuberculosis up until the year 2030. Now, how has that helped, or how would that help in translating into dealing with the issues of tuberculosis, not only in other areas that are severe, but of course in Nigeria and in Africa?
I think it was a great momentum in 2018 where our political leaders actually showed commitment to ending TB by 2030. That political commitment was an energizer, and in significant number of countries, it translated to a lot of actions at the different countries, specifically increasing some number of targets of individuals that need to be reached and put into treatment. Globally, we were actually in the right direction until COVID-19 hit. So the whole world was significantly improving in the performance of TB program, but unfortunately with the impact of COVID-19 and the current global crisis, the performance of TB program actually set back by more than 18%. Actually, we were seeing increased number of deaths for the first time in TB programs around the world in the last 10 years. But more specifically to Nigeria, for some level of resilience, for some innovative approaches from our ministries of health and our national TB program in Nigeria. Despite the COVID-19, they were able to be innovative in their response. And it was by creating significant community structures and using a lot of technology and using mobile diagnostic facility, Nigeria was the least country that was negatively impacted in TB program by the COVID-19. So Nigeria, based on that political commitment, based on the number of investment, and also the willingness to take innovation and overcome these challenges, Nigeria have performed in the last number of 3 years positively.
Thank you.
Are we in the right place? Not yet. There's still not less than 150,000 persons with tuberculosis being missed, meaning that they are not yet diagnosed and they are not yet put on treatment in Nigeria. So there's still a long way to go. However, we are all globally proud on the performance of Nigeria in the last 3 years.
And we also hope that some efforts will be consolidated on dealing with that particular issue in Nigeria and, of course, in Africa and other areas that are affected. Thank you so much, Dr. Gidado, for talking to us.
Thank you so much for having me.